Fill and pull, also known as an active voiding trial, is routinely done after pelvic surgery. This is a quick and easy way to know if a patient can void adequately. The whole process takes less than 10 minutes. It's ideal to have the patient stand and walk at least once after surgery before performing this to ensure that they are stable when they walk to the bathroom later. This is the equipment needed. A urine hat to collect the patient's voided volume. Place this into the toilet before performing the bladder installation. A collection container. A 60 milliliter TUMI or catheter tip syringe. Fluid such as sterile water or saline. A 10 milliliter syringe for catheter removal. Start by taking apart the Foley catheter from the bag or Foley plug. Drain the bladder with the Foley catheter. Having the patient stand to empty is also an option. This allows the bladder to be fully empty. Then remove the cap from the syringe tip and take the plunger out of the TUMI syringe. Next, connect the TUMI syringe to the open channel of the Foley, not the balloon port. Fill the TUMI with sterile water or saline to the 50 milliliter line. Let the fluid go into the empty bladder by gravity. On rare occasion, it may be necessary to use the plunger to instill fluid. Repeat this step until there is 300 milliliters in the bladder. You can go up to 400 milliliters if the patient doesn't feel a strong urge to void. The goal is to fill the patient until they get a strong sense of urgency. If the patient has a very strong urge or significant bladder discomfort prior to reaching 300 milliliters, stop filling and record how much fluid was instilled. When all the fluid is in, connect the 10 milliliter syringe to the balloon port and deflate the balloon. Keep holding the catheter above the bladder so fluid doesn't drain out. Also, fold the catheter to prevent fluid from leaking back into the TUMI. Then pull the Foley out of the bladder. If the patient has a sense of urgency, tell them to Kegel and hold the best they can. Assist the patient to the bathroom immediately. When setting up, consider placing the hat into the toilet so it's ready. Have the patient void into the hat and give the patient a maximum of 10 minutes to void. It is important to not allow the patient more than 10 minutes, as their bladder will keep filling naturally and the test will be invalid. Many nurses set a timer on their phone to make sure they come back within the 10 minutes. If possible, give the patient privacy and tell them to relax and not push. Another helpful tip is to turn on the sink so the patient can hear running water. Record the voided volume into the progress note when the patient is done. If they void 2/3 or more of the volume you instilled, then they've passed, and a new Foley catheter does not need to go in. For example, if you place 300 milliliters in the bladder and they voided 200 milliliters into the hat, then they've passed. If they void less than 2/3, then a new Foley should be placed immediately. In most cases, a bag or leg bag is not needed. If the patient had a cystotomy, then drainage with a bag is required. A Foley plug can be used, which is much easier for the patient and greatly increases patient satisfaction. The only thing needed is the Foley tube and yellow plug. When the patient feels the natural urge to void, then they'll remove the plug, drain the bladder, and then replace the plug. The fill and pull is a simple and quick method to test bladder function post-operatively. The overall idea is that their bladder is empty, you fill it to a known volume, they then void, and now you will know the volume voided.